forward. And really excited to have Sonia Smith speaking to us next on behalf of the Society for Behavioral Sleep Medicine. This is exciting because we need to hear their perspective, also because the Society is a new participating member this year. So, so excited to be growing this coalition of organizations and societies that are participating in this. So Sonia is also the owner of Emerald Coast Pediatric Sleep Consults, a pediatric nurse practitioner, and really excited to hear about the priorities and work of the Society.
Thank you. Can everybody hear me okay?
Yes.
Okay, perfect. Thank you so much for inviting me here today. I'm really excited to speak. Behavioral sleep medicine, like I said, it's kind of a younger organization, but I think it's extremely important, especially in light of everything that we've heard today with regard to access to care and prevention and other really significant issues. So behavioral sleep medicine is the study of behavioral, psychological, and physiological factors underlying normal and disordered sleep across the lifespan. So this is everywhere from really young children to the elderly. And it's also, we're involved in the development and application of evidence-based behavioral and psychological approaches to the prevention and treatment of sleep disorders and coexisting conditions. We're an interdisciplinary organization comprised, and this will be a future slide, but comprised of physicians and psychologists and nurse practitioners and others. And we're committed to setting the standards for and promoting excellence in behavioral sleep medicine. Our goals are to advance the field by furthering research. We really want to foster public awareness, identifying and addressing sleep health disparities, and advocating for integration and reimbursement in mainstream healthcare delivery systems. So as I said earlier, we're an interdisciplinary organization. We have psychologists, psychiatrists, licensed clinical social workers are very important in our organization, marriage therapists, sleep medicine physicians, and then of course, advanced providers. So one of the things that we do is, one of the main things that we do is treat insomnia. It is the most commonly reported sleep disorder. And there are other sleep disorders that we're also heavily involved with, like circadian rhythm disorders, disorders of hypersomnia where people sleep too much, parasomnias, which are behaviors that occur in and around sleep, like sleepwalking and nightmare disorders. And also, very importantly, as we just discussed, CPAP adherence or PAP adherence. One of the main ways that we treat our patients is through a technique called cognitive behavioral therapy. And many behavioral sleep medicine interventions are based on CBT. And it has two components. It has a behavioral component as well as the cognitive component. And the behavioral component focuses on eliminating those habits and behaviors, environmental disruptions that stand in the way of quality rest, things like sleep hygiene, especially, and stimulus control, things like that. The cognitive approach focuses on looking internally, thinking about how people think about their sleep and what kind of fears they have surrounding their sleep, those thoughts and beliefs that contribute to poor sleep. It's supported by scientific data and has a very successful track record for treating a variety of sleep disorders. Most therapies for CBT are brief. They involve multiple sessions and treatment visits. And the psychological and behavioral interventions are effective, and they're actually recommended as an initial component in the treatment of chronic insomnia. This is a really good article that speaks to healthcare utilization costs among untreated patients with untreated insomnia. This is the little summary of that article. And a total of 151,000 Medicare beneficiaries were found to have insomnia. And it was noted that they had higher rates of healthcare utilization across all points of service locations. Also, higher all-cause costs, driven primarily by inpatient care. And this is another really good article that talks about the efficacy of CBTI in treatment of insomnia. And it does show that CBTI can reduce healthcare utilization and costs, and insomnia remains an untreated disorder, and behavioral treatments can help to improve access to care and reduce the burden of insomnia. So again, CBTI and the work of behavioral sleep medicine is integral in treating insomnia and lowering healthcare costs. Some challenges that we have in behavioral sleep medicine, I think, are pretty common for a lot of sleep medicine providers, and some of this has already been touched on in previous presentations. The first being access to care. The availability of behavioral sleep medicine providers. There aren't that many of us out there. And diversity and health disparities, and then reimbursement pathways are extremely important. We also need a collaborative strategy to work with other organizations, and then the provider reimbursement is a huge issue for us. So regarding the number and distribution of trained behavioral sleep medicine providers, our most current estimate is around 2,000 here in the United States. But with a need of one specialist per 100,000 population, we need to train over 3,000 professionals. So you can see we're very disproportionate to the number of people who actually could benefit from our services. California and New York have the most number of providers that we're aware, and Southern and Midwestern states are the most disparate. The SBSM has accredited 18 national and international BSM training programs to date, and there is an exam that can be taken to confer the Diploma of Behavioral Sleep Medicine, and so far 230 practitioners have achieved that designation. Our colleagues just spoke very eloquently on the benefits of telemedicine. As they were talking, I was thinking about the fact that that the one good thing that has come out of COVID, if anything, has been the advent of telemedicine, particularly for behavioral sleep medicine. It is very convenient to the patients, obviously, but considering the fact that cognitive behavioral therapy involves multiple visits, sometimes it is very difficult to get patients to follow through with the program if they have to come back week after week. So it has been very, very helpful to promote adherence if they can just sit in front of their computers or on their phones and conduct their next visit with their sleep medicine provider that way. And also, it increases access to behavioral sleep medicine providers. We've just seen that there is a paucity of sleep medicine providers here in the United States. And if we can reach more people through telemedicine, all the better. There also needs to be more research on and interventions for disparate health groups that address socioeconomic challenges, cultural diversity, health literacy. There is a component where you actually have to be able to understand, how to fill out sleep diaries and things like that. So health literacy is a huge issue. And also mental health challenges, depending on how severe they are, sometimes that can be a huge impedance to the success of our programs. And then access to reimbursement pathways. There are limited access to financial resources for a lot of people. Cash and out-of-pocket expenses, if they don't take insurance, can be very cost prohibitive, which is a huge barrier. And then limited access to third-party coverage for healthcare, particularly in the area of mental health. Mental health coverage is lacking in a lot of insurance policies. We would really love to see more of a collaborative strategy with regard to behavioral sleep medicine, partnerships with national organizations such as the AASM, the American Telemedicine Association, the APA, and National Sleep Foundation. And then also education and partnerships with local community organizations such as private practices. We just talked about the role of primary care and in treating sleep disorders. So that would be lovely to be able to include some behavioral sleep medicine in their practice as well. There's a rarity of integrated practices of psychology and medicine. Usually you do not find psychologists in traditional medical offices, but it would be wonderful to have a psychologist present, particularly in sleep medicine offices. Also other healthcare institutions and working with schools. We were talking about Start School Later. Again, that would be very, very helpful in the treatment of behavioral sleep problems. Provider reimbursement, as I just touched on, is a huge problem. Medicare sets the standard for payment rates, of course, and psychiatric and psychological services are reimbursed at rates substantially lower than commensurate medical services. Psych interventions may require also pre-authorization. We just touched on that as well. Pre-authorization, if anybody's ever had to do it, you know how difficult it can be. There is a lot of additional paperwork, which is additional time spent away from patient care. Often, if it's rejected, you have to do peer-to-peer interviews, which is more time on the phone trying to convince them to authorize the intervention that you're asking for. And then just the process of appealing should they, again, reject. So it's a lot of time spent away from other aspects of patient care. Some insurance carriers do not allow billing for psychological testing and diagnostic interview on the same day. So you have to have the patient come back on a different day just to complete what would ordinarily be just one visit. So that also is another barrier to care in case they decide to not show for the second appointment. So our call to action is we ask policymakers to help the SBSM advance the mission of providing cost-effective, evidence-based interventions to patients across the continuum of biopsychosocial health and wellness. We invite policymakers to partner with us to identify and recognize health disparities that impact care delivery and implementation of interventions, to increase recognition of sleep deprivation as a national health crisis and a chronic health issue, and also support continued payment for telemedicine services post-pandemic, as someone just mentioned. That's going to be extremely important moving forward. We also invite policymakers to support insurance coverage for evidence-based technologies as they become available, such as wearables and things of that nature. Support insurance coverage and fair payment models for non-physician providers who provide behavioral sleep medicine care, such as psychologists, and support coverage for mental health services for disparate populations. Would like to acknowledge Ryan Wetzler and Catherine Hansen for their help in this presentation. And I thank you very much.
Thank you so much, Sonia. I think this is really important. And a lot of it's even, new information to me. And I think that's, why we're doing this, to bring those perspectives forward. I think when you said that thing about not being able to test and treat in the same visit, I'm like, what? That's, yeah. And I don't know everything that goes behind that, but as you say, it seems like a major barrier. So really glad to have you here, start these conversations, and continue to have your society a part of these efforts, because I totally, you'll see all these great comments about CBT approaches, helping people with sleep disorders in the comments. So, this is part of, hopefully a multidisciplinary approach to care that will continue to expand. And so addressing these issues will be important along the way.